Hi, I'm Mel Bellin. I'm an associate professor here at the School of Social Work, where I chair our health specialization. I've also been engaged in spina bifida research for going on 2 decades. About 3 years ago, a group of approximately 100 healthcare providers from around the world came together to start to create guidelines to provide some consistency in care across the lifespan for this special population. For those of you who don't know about spina bifida, it's a congenital neural tube defect that occurs early on in pregnancy, so often before a woman even knows she's pregnant. And it leads to multi-system challenges, from orthopedic concerns to urological to renal. It really impacts that child across the lifespan. And together, we wanted to create guidelines to help provide some support to interdisciplinary clinicians to help them best serve this population, whether that's working with a team of nurse specialists or medical providers across disciplines, physical therapists, occupational therapists, and of course social workers. We wanted to give them support to how to work with this population from birth through adulthood. This effort has been led through the Spina Bifida Association of America. We initially started to draft through 25 different working groups what we felt were best practices based on the evidence and based on scientific proceedings from a range of different sources. And in our working groups, we collectively prepared clinical guidelines to really provide oversight to the management of this condition. I was part of the Spina Bifida self-management working group alongside nurse as well as physicians. And from our efforts, we wanted to help not only providers but also families prepare for working with the child early on and developing and fostering autonomy and responsibility. Because we know from the literature that children who are given the opportunities to help manage their condition and to develop the skills for independence in the community early on, that if we start to work with them even as early as age 3 to 5 on some basic tasks and skills, that they have a higher success rate of being integrated into the community when they reach adulthood. But it's a big deal because we have this interdisciplinary lens that we're bringing together medical providers from a range of specialties, urology, neurology, orthopedics, neurodevelopmental disabilities. We're bringing in psychologists, nurses, physical therapists, occupational therapists, and a couple of us social workers. It was really critical to have the social work voice in this because oftentimes we have treatments that are recommended that in actuality are difficult to implement for a variety of reasons. Perhaps there are challenges related to poverty. Perhaps a family may be experiencing significant stress and that really permeates throughout the family system. Perhaps there are concerns related to mental health. Maybe that's for the child or perhaps for the parent caregiver who's overseeing the kiddo. So it's important to have that social work lens for us to better understand how individual family as well as environmental factors might impact the implementation of guidelines.